Hi guys, welcome to my YouTube channel. So today we'll be covering the topic of pre-malignant lesions of the oral cavity, that is leukoplakia and erythroplakia, and these are the conditions of the oral cavity which can lead to cancer formation. So in these two topics, erythroplakia and leukoplakia is an important short note and it can come in your theory exams. So let us move on with this topic. The number one will be definition. So I'll be discussing the topics in a way that you can write an exam. So if you just read this PPT, it will be enough to gain the desired marks. So let us start with the definition. As per WHO, it is a clinical condition where there is a white patch which cannot be characterized clinically or pathologically as any other disease. So by this we can say that it is like an exclusion criteria. When it is not anything else, it can be leukoplakia. And the other white lesions, like if we have to see the differential diagnosis, it can be lichen planus and candidiasis, because in these conditions also there is a white patch. So it happens in mainly in 40 years of age group and more common in males. And the histology is dysplasia. What is dysplasia? That is the abnormal increase in number of abnormal cells. So there is more chances of malignant change whenever there is dysplasia, because that is when the abnormal cells will be produced and anaplastic cells will be produced. So it has only 5% malignant potential, and as compared to erythroplakia is very much malignant. So next will be the etiology, that why this leukoplakia happens. So it can happen due to smoking, tobacco, alcohol, the chronic trauma, that can be due to the ill-fitting dentures when these are put in the teeth. So these can also produce, and this is very much associated with oral submucous fibrosis, which will be covering in another lecture. So the sites will be the buccal mucosa. In India, it is the most common area, the buccal mucosa of the mouth, and the oral commissures. These are the most common. And the other sites can be like the floor of mouth, the tongue, the gingivobuccal sulcus, the mucosal surface of lip. These are the other sites where leukoplakia can happen. So if we look at the types, here you can see the white patches, white patches on the mucosal surface. So their types are homogeneous, nodular and erosive. So there are three types. Nodular is also known as speckled, and erosive is basically erythroleukoplakia. What do you mean? That it is a combination of both erythroplakia and leukoplakia. So the erosive form has erosions and fissures, and the latter two, that is the nodular type and the erosive type, they have a very much higher malignant potential. So if we see that how to manage a case of leukoplakia, so many disappear spontaneously if the causative agent is removed. So what were the causative agents? Yes, smoking, tobacco, and trauma due to ill-fitting dentures. So we can also do the biopsy, because as we said in the first definition, that it is based on exclusion criteria. When we cannot find any pathological cause or any other cause, then we can see it's leukoplakia. So we have to do the biopsy to rule out malignancy, because it is a pre-malignant condition and it will also later on lead to cancer. So we have to see that what is the stage of the disease, what is happening in the tissue. Then after we do the biopsy, we can do the surgical excision or the laser ablation or cryotherapy. So this was about the leukoplakia. If we revise it, it is a condition, it is a pre-malignant lesion of the oral cavity, which is a white patch which cannot be characterized clinically or pathologically as any other disease. Its differential diagnosis will be candidiasis and lichen planus. It happens in 40-year age group in males, and histology will find much of dysplasia in the tissue, and it is a 5% malignant potential. It is due to smoking, tobacco, alcoholic and chronic trauma, and it is very much associated with oral submucous fibrosis. The site is buccal mucosa, which is the most common site in India, and the oral commissures, which is also a very common site. And the other sites are floor of mouth, tongue, gingivo-buccal sulcus, and mucosal surface of lip. Then we read about its three types, that is the homogeneous, nodular, and erosive, in which the nodular and erosive have a higher malignant potential. Then in the management, we see that it can be spontaneously disappeared in time, and we have to do the biopsy and then the surgical excision or laser ablation or cryotherapy. Few words about erythroplakia. It is a red patch in comparison to the leukoplakia, which was a white patch. Erythro means like a red color. So red patch or plaque on the mucosal surface. There is decreased keratinization. That is a red vascular connective tissue of the submucosa. It shines to it, because if the keratin will not be there, then the inner layer will shine through the upper layer. So there is red vascular connective tissue underneath that. So because of decrease in keratinization, we can see the red color. And the most common site will be lower alveolar mucosa, gingivo-buccal sulcus, and the floor of the mouth, as in comparison to the leukoplakia, which was more in the buccal surface and the commissures. This happens in the lower alveolar mucosa, gingivo-buccal sulcus, and the floor of mouth. And there is severe dysplasia. That is, there are a lot of abnormal cells, there is a lot of dysplasia in the tissue, and therefore its malignant potential is the 17 times more than leukoplakia. So if leukoplakia has a malignant potential of 5%, then erythroplakia has a malignant potential that is 17 into 5%. So it has a much more higher potential to generate into cancer, to produce cancer. It has types like homogeneous, speckled, granular, and erosive. In erosive, we have seen that is a combination of both erythroplakia and leukoplakia. So homogeneous, speckled, granular, and erosive. So its management will be excision biopsy. We have to excise it and then follow up for the patient. And that is all for the pre-malignant lesions of the oral cavity. I hope you like it. These are very simple notes, and you can note it down, or you can ask for this PPT. And leukoplakia is a short note, and I hope this video will help you. Thank you.